You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, this is a first. We have our first guest who's been on the show 3 times. Welcome back to the show, Margie Davenport. Yay!
Thank you for having me. So nice to see you again.
I know, you too. I was like, really? This is the third time again? It was like 2022, and then I think we must have recorded last spring, and then it went
Oh, wow.
the episode went in August because I typically don't record over the summer.
Mhm.
And then I was preparing for this episode and just scrolling through PubMed and pop your name in. And I had to finally stop because 2025, I don't even know if you've counted how many papers have come out with your name on it yet. There's a few. Um, so, so tell us what you've been up to, and we can talk about some of those really cool papers and big Canadian guidelines and all that good
Yeah.
stuff. How about that?
Yeah, no, it's been an exciting year since the last time we chatted, actually. So I think what you're seeing is actually everything sort of coming together. A lot of this work has been in progress for multiple years now. The guidelines, especially. So the 2025 Canadian guideline for physical activity, sedentary behavior, and sleep throughout the first year of postpartum will be coming out very, very soon. I actually got the proofs this morning, so it's pretty exciting to see that actually come together. And so a lot of the other papers are actually the underpinning evidence that will be supporting those new guidelines. So it's been a massive team effort. I have a really phenomenal group of people that I work with, especially on this guideline. Well, just in general, but on this guideline as well. And so it's really a reflection of the work that they've been doing over the last year. And so it's pretty exciting to be able to start talking about it.
Yeah, I know. You're like, I think I asked you earlier in the year to come on. You're like, nope, wait, just wait.
Yeah.
I'm like, okay, whatever she tells me to do, I'll do. So when you're pulling something together as big as guidance for a country for exercise in pregnancy and postpartum, like
Mhm.
you talk about these underpinnings that have to occur, kind of this foundational information. What's some of that you had to do that now has kind of come out but things that needed to be sort of set up as that foundation?
Mhm. So there are lots of different ways that you can put together guidelines. At the very sort of most basic level, you can get together sort of like general basic guidance, generally expert opinion. And those are, they can be really great. They're quick and easy to do. But what I would typically do is there's a really rigorous gold standard process called Agree To that we follow. It's designed to be rigorous, transparent, do a lot of consultation to try and make sure that the guidance and the guidelines that we're actually coming up with are based on the key priorities of the population that it's informing. So in this case, it would be postpartum people. And so we spent a good chunk of time first doing consultation to see what particular health outcomes were most important to them. And then based on that, we did 7 systematic reviews and meta-analyses. If you're not that familiar with what they are, it's basically a synthesis of all available information about postpartum exercise, sedentary behavior, and then sleep in the postpartum period. And so that's what's been coming out over the last couple of months. And then along with that, we also have our new Delphi study. That was so much fun to do. So if you haven't seen it yet, basically we have the 2025 guideline consensus panel that was part of it, and then I was able to recruit sort of the leads on other major guidelines around the world with the goal of identifying sort of a global consensus of what are key contraindications or medical reasons why you should go and get advice from a healthcare provider before, either beginning or returning to postpartum physical activity, but also identifying things that are not contraindications, but are
Mm,
typically barriers to physical activity as well in the postpartum period. So things like pelvic floor dysfunction, sleep,
right.
fatigue, and really trying to shine a light on the postpartum period. The goal of the guideline is to really encourage movement, especially early movement,
Yeah.
as much as possible to be able to support the holistic health of a postpartum person. Certainly the physical health, but essentially mental health as well.
I loved kind of seeing some mental health and anxiety kind of stuff come through because I feel like they run together, and of course you throw sleep in there for sure. For you, why was it so important to have this in writing that early movement is good? What are we trying to counter essentially?
So for a very, very long time, we've had this idea that you really shouldn't do much of anything for the first 6 weeks after delivery. And then as soon as you get your 6 week checkup, that you're check clear to go and you can go do whatever you want. And I think, with the exposure and, especially with the advent of the 2019 return to running guidelines,
Yep.
some very well-known physiotherapists put together and really changed the way that the entire field started to think about things that you're not just like immediately cleared after 6 weeks
Right.
postpartum, but it's actually a rehabilitation process, and it should be early, starting fairly early afterwards. We have data which actually suggests that pretty soon after birth, if you start to have higher number of step counts, I'm not saying go for a run like the day after delivery, but
Yeah.
it's okay to get out of bed and after a C-section, do a few extra steps, and that actually helps to facilitate healing and postpartum recovery. Actually,
Yeah.
so there's data that's emerging that's starting to show that, and so trying to counter this idea that physical activity in the first 6 weeks postpartum, especially, is harmful, is something that needs to get out there to be able to support mental health. We know
Yep.
those first 6 weeks are actually really, really critical for there's an increased risk of having postpartum depression,
Yeah.
anxiety. And if you take away one sort of key tool to be able to improve overall mental health, we're doing a major disservice to postpartum people. So
Yes.
that's just one of the key recommendations.
Yeah. And that one, I think it's an interesting one for those of us that have been in this space for a long time.
Mhm.
We're just so pumped that now we have a reflection of what we've been talking about, this change that's in black and white, and we can use that. And on
Mhm.
the other hand, even just as recently as the last 2 months, I had a new mom um, told after a C-section that she couldn't walk the first and whether it was said to her or not, it does not matter. It's
Mhm.
how she took it.
Yeah.
And unfortunately, this mom had to go back to work within 1 to 2 weeks after her C-section. And
Mhm.
so I had to check myself because on one hand, I'm like, oh my God, this poor woman, you know, first kid, have to go back to work. But on the other hand, she was also told not to do walking, but she had to for work. And so
Mhm.
this actually worked out. So I'm not going to like really, I'm going to let her know, hey, you're doing great. This is wonderful. I'm glad that she had to go back early in some ways
Mhm.
because it countered the really, really wrong advice that she was given. Like,
Mhm.
how is this still? I live in a major metropolitan area. This is a very educated woman. How is it that she was still told or it was interpreted that she shouldn't be walking? Like, this is
Mhm.
crazy.
Yeah, it is. It's really unfortunate, but that's why we need these
Yeah.
guidelines that are put together by major national, international organizations to
Yeah.
provide clear, evidence-based information and guidance. And certainly, many of the recommendations are things that are being done by well-informed practitioners like
Hmm.
yourself and have done for a very long time. It's putting this into black and white and
Yes.
having the evidence that supports it directly in those hard numbers. I think that you cannot understand or understate it when we're trying to action change, especially
Hmm.
with clinicians who are going to be some of the first people that are seeing women after childbirth,
Right.
to be able to say there are these new guidelines, this is evidence based, early movement is great.
Right.
You do have to have a graded, individualized return to
Yeah.
Moderate to vigorous intensity physical activity, but early movement is beneficial. And, returning to that moderate to vigorous intensity physical activity as well within the first 12 weeks postpartum is actually really beneficial for mental health.
Yeah. No, definitely. Definitely. I'm curious how you anticipate this being used not only as clinicians to kind of like us as physios, um, to kind of almost hop that fence and get it into the hands of those people that are unfortunately still saying, oh, you shouldn't be doing like basically our OBGYNs. I'll just be honest, our birth professionals, that's where sometimes the seed gets planted and it takes a while for the information to get from us to them. What are your thoughts as to how we as providers can, disseminate that information or kind of almost like walk back up the chain and be like, hey, you guys, can you stop sending this down?
Yeah, absolutely. And I mean, that's always the hardest thing. So,
Yeah.
I led the development of the 2019 Canadian guideline for physical activity throughout pregnancy, and we had a massive push to be able to do what we call knowledge mobilization. So it's taking the evidence and getting it into hands of the people that are going to use it. We'll do
Hmm.
the exact same thing in the postpartum period, but it is a really an uphill battle. It's a slow process. It's something that is so, so essential. And so we do have a big push coming. There's going to be what I hope is going to be a pretty big media release. We're going to do a lot of work on social media, but um, you know, increasing awareness. So doing podcasts like this is why I'm
Yep.
here for the third time, is that, you know, being able to explain what it is that we're doing and why and what the evidence actually is, I think is really, really important. But then I think it also, there are more of us that have a voice that are speaking the same message is actually really important as well. And
Hmm.
having the guidance at the same time in your hands to be able to say, this is what Canada says. This is the evidence. There's 594 individual studies that support this particular
Right.
set of recommendations. I think there's a lot of power in trying to get it out to a wide audience, but it certainly takes time.
Yeah. There was and forgive me because I couldn't read it with small print. I've seen some of you in your social media have been holding up or a kind of a screenshot of the I think it's a screen. Like talk me through what this is and kind of how did you kind of come to pulling it all together?
Okay. So I will absolutely send it to you. It's called the Get Active Questionnaire Postpartum. So if you are familiar with the pregnancy physical activity pre-screen, the Get Active Questionnaire for Pregnancy, it is basically the sister document to that. So what we did is an international group of, sort of leaders in physical activity in the postpartum period. We met, we put together a Delphi study, and because there's virtually no evidence about what would be a contraindication to physical activity postpartum. And so we surveyed, well, I'd have to look at the numbers again, just off the top of my head, over 100 professionals that work with postpartum populations to get their opinion about what would be a key contraindication. Sort of work through a very rigorous process. And in the end, we actually have no absolute contraindications to postpartum physical activity. The reason for that is that we did not want to unnecessarily restrict people from being physically active postpartum. And so there are a number of relative contraindications. So the difference between those two, an absolute contraindication would simply mean that you are not supposed to engage in sort of moderate to vigorous intensity physical activity. Going for a gentle walk to the mailbox or things like that would still be recommended. But with a relative contraindication, you would still go and speak to your healthcare provider and talk about, is physical activity still, beneficial for you, or do you have to make some modifications, or in a very, very minority of cases, is physical activity not recommended
Right.
in the moderate to vigorous zone. And so, when we're talking about what those key contraindications would be, they're pretty substantial. So For example, if you had loss of consciousness for any reason, if you had high blood pressure that's not stable, but then also very sort of postpartum specific contraindications as well. So if you had postpartum cardiomyopathy or C-section pain that worsens with exercise, things like
Hmm.
that as well. But really tailoring it to the postpartum population. And so we have this screen that is, I'll send it to you, but it's going to be publicly available by the time this actually gets out.
Yep.
And so it's been endorsed by a number of organizations
That's
around the
great.
world and is in the process of being translated into, I think we have the first three are set up to go,
Mm.
different languages. And the pregnancy questionnaire, we have it in 13 languages. So I expect it'll be very similar.
That's nice that you have kind of almost this template with the pregnancy guidelines that you're just able to extrapolate forward. What kind of what lessons did you learn about putting that out that you really applied in kind of getting these postpartum guidelines out?
Sorry, in terms of like the postpartum knowledge translation, that sort of
Yeah.
thing,
Yeah.
that you have to do it.
Yeah. It seems
And also,
obvious,
yeah,
but
yeah, it seems really obvious, but I think also, really thinking outside of the box, like traditional media is really important. So, getting into in front of TV cameras, which I can't stand doing. I'm not very good at it,
it's the
but
worst,
it's
isn't it?
something that you have to do. Live TV, I get very stressed about. So, if you see me on live TV and I start to be like, I don't know, but those are really, really important. Same thing with
Yeah.
print media. But I think that there's a lot of power now that's quite different when back in 2018 when we released the
Right.
pregnancy guidelines. 2025, social media spreads like wildfire,
Hmm.
and so you can actually reach a much broader population
Yep.
in that way, but also having a really coordinated effort to be able to disseminate this information as much as possible in a variety of different ways is, I think, super important. But talk to
I
me in
noticed
another
that.
month and I'll let you know how it goes.
I noticed that yesterday. A handful of you, I think it was like you and Rita, Christina, there was somebody else I saw, very coordinated yesterday. Really nice job. That was a nice job. No, I mean, and that's why I got super excited. I was like, wait, where do I get this? It just made me want to
Mhm,
immediately go find that information and read more about it. And I would hope that, as you pass the torch down to the rest of us, we're able to continue to pass it down to everyone behind us,
mhm.
and just kind of build that standard. Um, so Delphi study, we've got this out. Did that somewhat inform the Canadian guidelines as well?
Mm, so it's a piece of it. So the seven systematic reviews and meta-analyses, they really did drive the
Yep.
recommendations that we have with the postpartum guidelines. The Delphi study was informing what would be a contraindication.
Gotcha.
And then based on that information, that's when we developed this new tool. It's designed to be self-completed by postpartum people. They can fill it in themselves and identify whether or not they need to get additional medical guidance about physical activity postpartum. That would be a
Mhm.
minority of people that would be redirected to their healthcare provider. But for the vast majority, they will get this, sort of check you are okay to restart or
Yep.
begin for the first time physical activity in the postpartum period. So, taking away one of the really key barriers, which is getting this medical clearance at 6 weeks
Right.
postpartum, it allows you to do it a little bit earlier for sure.
Mhm.
But it's really designed to empower people in the postpartum period to um, you know, take steps towards,
Yeah.
re-engaging in physical activity.
Yep. No, I like having the ability to hand somebody something that it doesn't require, anybody particular to, administer the screen.
Mhm.
Just because especially those first time moms that are like, I want to do the right thing, right? And they don't want to wait till 6 weeks.
Mhm.
And at least here in the US, I think it was like back in 2018, we were supposed to like there was the fourth trimester
Mm,
paper that was put out by ACOG.
yes.
And they kindly wrote physio in one section, which we could have been in the whole thing. But that has not, at least not here in the States, has not held true. Like I have
Huh.
moms that are C-section moms that are getting their first visit, not at 2 weeks, at 6 weeks, because
Hmm.
everybody is just overwhelmed. We've got tons of people leaving the medical profession.
Yeah.
And it really just does leave those moms high and dry, and
Hmm.
especially those ones that are feeling good. And I think that's
Hmm.
what we forget sometimes as physios. We're like, nope, you should see a physio first. I'm like, well, can we just do some basic clearance? If people are feeling good, can
Hmm.
we let them start? Because I've also learned that like sometimes I'm not going to know how you're going to do with stuff until you actually go do it.
Absolutely.
I'm not going to know how walking feels to you until you actually go walk, and you have to walk a little ways, and then maybe something shows up. But yeah, I think it really kind of tears down that gatekeeping of
Hmm.
information, saying, "Well, you can't do anything until I've given you my blessing." That whole
Hmm.
thing.
Hmm.
Um, so in general, and forgive me, I'm not quite sure how the pregnancy guidelines or the pregnancy kind of screen went out. Is it expected that this would be just available in, physicians' offices or just online and people find it themselves, or like how is it expected that people would find access to this
Hmm.
information to be able to do a self screen?
Hmm. So the Get Active questionnaire postpartum is actually embedded within the Canadian guidelines. So we have
Mm,
two full dedicated pages of it.
lovely.
And it's funny because you said that we were coordinated. We actually the Delphi paper actually came out slightly sooner than expected, so the website was not actually up yet.
Oh
Um, which is totally fine. It will be up before the guidelines come out.
no. Okay.
But it's been a little hectic, and so there's been a little bit of changeover. So
We
we
won't
weren't
tell.
actually as coordinated as we could have been, but we certainly tried.
I think
And
when you're a mom, you just sort of run with it. You're like, whatever.
pretty much. It's like roll with the punches, everything works out.
Yep.
Um, but it will be available on the CSEP website for sure. It is, the Canadian Society for Exercise Physiology actually supported the open access fees. So
Oh,
to
that's
make papers
amazing.
open access is very, very quite expensive.
Yes.
And this was actually a completely unfunded project. We we just made it work pretty much. But it was so needed. It's like
Yeah.
something that I just couldn't sit back and watch, continue to drift. The lack of guidance and information. We really needed that to start.
Mhm.
Um, and so it will be publicly available very soon. By the time this podcast is
Yep.
out, it will
We will
be
make
up.
sure of it.
We
We
get
will hold this until it's time.
Mhm. But then we also go through the process of getting what we call endorsements. So the endorsement
Mhm.
process, when we do the different translations, so we go to Poland and Anna, who is on the Delphi study, she will do the translation. It's a very rigorous process. It makes it culturally relevant at the same time. But then she sends it to the Polish Society of Obstetricians and Gynecologists in
Mhm.
Sports Medicine to get their endorsement. They put it up on their website.
I see.
And so it's a longer process for sure, but the endorsement makes it more widely available as well.
Yeah. No, I think that's fantastic. Well,
Hmm.
and I think, in the meantime, those of us that do know about it, obviously we're going to use it as much as possible. I don't know what we're doing in the United States as far as research these days. We'll just let that sit the way that it is, but we appreciate you letting us borrow it.
Well, there were a couple of Americans, very well-known Americans,
Yep.
that were involved in the Delphi and were really
Yep.
critical for its development. So there's
Yeah,
certainly an
Rita's on it,
American.
and then Shafali, I think,
Yeah,
was on it,
yeah,
and then who was the other one? Was
those two.
Okay. I was like, "There's a third, really?"
Yeah, no, no, no. Sorry, did I say three?
No, it's okay. I probably just, like, am trying to, like, create a third and be like, "Who is
Yeah.
this? I need to know who they are."
Yeah, but it was a lot of fun. We have representation from 7 different
I
countries.
know.
So,
It looked like a really cool
mhm.
house party is what it looked like.
Yeah, there was a it was It was so neat to, it's great because we all have like our own slightly different perspective, whether
Yeah.
it's based on the research that we do or culture or anything else. And
Yeah.
just like some of the conversations, I've never had before. And so it was a very
Mm.
robust and exciting
Yeah.
series of conversations. So it was great.
Can you give me an example of like something where you're like, oh gosh, I've never heard that before. This is not typical Canadian culture. Anything that you can reference?
Um, I'll tell you offline.
Okay. Now we're gonna have Active Mom Podcast after dark. I gotcha. No, it's so interesting. As I get DMs from people all the time all over the world, and I think being in this space where I know so many of you that are amazing researchers, even in countries that you guys live in, where somebody will reach out to me and be like, hey, this is the care that I've gotten here. What are my options? Because I'm seeing stuff online and I'm not seeing this in my country. And it's hard because I'm like, I know there's good people, I know there's good resources, and again, things like this that do get disseminated, I think it gives me hope to kind of be able to pull in everybody so we're all up on that same level. Because I think one of the beauties of the internet has been we get to connect with so many people in so many different countries and see what standards of practice are. But there's a lot of variability in practice patterns across the world. Like some countries, I feel like, oh yeah, I did that maybe like 15, 20 years ago. And it's
Right.
frustrating for patients to see, well, I went to my local physio and this is just not the care that I'm getting. So I
Mhm.
do think that there's a huge role of these standards and kind of being able to at least give to them, hey, this is a screen, this is where we can start, to help kind of bring people along a little bit. So
Mhm.
that's fantastic. All right, let's talk about. So we talked about Delphi. I have this whole list of papers, and I was like, I don't like how much time we got. What are we gonna talk about? You did. Let's just kind of talk just high level sorts of things. There was a paper kind of looking at the impact of sleep. Um, Talk to me about sleep because that I'm glad to see that in writing.
Yeah,
Considering my oldest did not sleep the first 5
mm,
years of his life.
yep, I know that one.
Yep.
Yeah, so, it's interesting because, my experiences with postpartum, sleep was far and away the hardest. Like my kids did not sleep. I felt absolutely terrible. I was able to, be physically active postpartum, but yeah, I didn't sleep for years, and my
Yeah.
kids are just over 2 years apart. So,
How
one
old are
was
your
sort
kids
of
now?
asleep, and then
I know. How old are your kids now?
they are 10 and 12.
Oh god, yeah. So yeah.
Mm-hmm. Yep. Yep.
That's right.
Just
You're
like
sneaking
quick.
right behind me.
Yeah, exactly. Um, and so, when I was like starting to be like, we really, really have to start to put some guidance together about postpartum, like sleep is just such a critical part of it.
Mhm.
And I think, I'm actually expecting a lot of pushback on the sleep side of it, but I think it's also really important that we reflect on the fact that, certainly there's very little control over an infant
Mhm.
who is like, you know, really hungry all the time, just wakes up all the time, light sleepers like mine were. But the evidence is actually quite strong that if you don't get sufficient sleep, that it increases your risk of depression.
Yeah.
It increases, cardiovascular disease. You're going to be fatigued. You're going to be
Mhm.
irritable. That describes me to a T,
Yeah.
right? Like I was grumpy all the time.
Yeah.
And I think that to a certain extent, we've normalized that this is what happens in the postpartum
Right.
period. And for to a certain extent, it absolutely is. Like, no baby is going to come right out of the womb and start sleeping for 12 hours a day.
And if they do, don't tell anybody.
Yeah, no, exactly. I would not appreciate that.
No.
But I think that there are strategies that can be implemented to help to improve sleep. And so that's why we were looking specifically at sleep on health outcomes and then physical activity and exercise and sleep in the postpartum period. And what we did find is that, contrary to what you expect, if you're physically active postpartum, you do have reductions in overall sensation of fatigue, and you do have better sleep quality. You might not sleep more, it might still be fragmented, but when you're sleeping, your quality is better.
Yeah.
On top of that, and this is where I find it might be, we are getting pushback in the consultation. Like this is not something that I can do, and totally fine. Everybody gets to the point where they're ready to do some sort of intervention in terms
Mm-hmm.
of supporting infant sleep.
Mm-hmm.
And what the data suggests is that if you implement a sleep intervention, so this can be just as simple as education about sleep patterns and different strategies, that this actually reduces depressive symptom severity. And so we can't underestimate the importance of sleep postpartum, but
Mm-hmm.
we also have to be really clear. We cannot leave people into the postpartum period to make all of these changes entirely on themselves. It is
No.
absolutely the job of, the partner, the family, society to help support postpartum women to be able to make steps towards improved sleep,
Yeah.
increased physical activity. But normalizing poor sleep for 5 years, if I could go back and there was, a strategy to, my baby will actually go to sleep and stay asleep if we put them down, 30 minutes earlier, or actually,
Mm-hmm.
my goodness, have a scheduled sleep schedule, because I had no idea baby needs a
Mm-hmm.
sleep schedule. Um, and so I think just thinking about that and trying to start the conversation. I was very anti crying it out,
Yeah.
and the interventions that were being implemented didn't involve crying it out. It's just
Yeah.
education and using different strategies to help the baby to sleep a little bit better.
Right.
Yeah. Anyways, it's
Yeah.
an
That
important
one.
one, but
Yeah.
it's also one where we can't normalize it, and we have to really emphasize the
Yeah.
importance of the social support to be able to achieve any of these recommendations.
Yeah. No, and I think that one, like to have data to go into a very polarizing conversation,
Mhm,
because especially those of us that had kids that did not sleep, you're blaming
mhm.
yourself. You try and read all the books. Your kid didn't read the book.
Yeah,
And then things that work, you're told not to do, like don't sleep with your kid or, co-sleep
yeah,
or, this or that or whatever. I'm like, but I just want to sleep, you know?
yeah.
Um, and I think, that probably was one of the hardest things as a new
Mhm,
mom. If there's one thing that I wish I had a do-over with the brain that I have now, because I have so much empathy for that me,
mm,
is she was just exhausted trying to do the right
mhm,
thing with a kid that just like, and but yeah, I remember, when I was finally able to get out and go for walks and things like that. Yeah, that definitely made me feel better.
mhm.
And you made those things priorities. But again, at the time, like if you're in a play group or a mom's group and everybody's talking about how wonderfully their baby sleeps, you're like, well, I don't even want to be here because like,
Yeah, yeah. No, absolutely. Those are the worst things to hear when you have a
mhm.
kid that does not sleep.
And then project forward. My son is now 14 and he's my height, which is insane.
Mm.
And on the weekends, he sleeps easily till 10 or 11 in the morning,
Oh, wow.
because he's a teenager.
Mm.
And I laugh at him because I'm like, great, I appreciate that you're giving this sleep back to me, but I could have used that a long time ago. Like, you're a little late on the payback.
My kids aren't quite there yet, but I look
Give
forward
it
to it.
time. I promise you it's coming. It's coming.
Mhm,
All right. So, sleep. Um, Definitely we need to be talking about it. We need to be helping moms have strategies, have
mhm,
communities, have family help, that sort of thing.
mhm,
Um, Another systematic review and meta-analysis you guys did, impact of exercise on musculoskeletal pain and disability. I feel
mhm.
like that's a no-brainer, that needed to be written. I mean, it sounds like you thought it was a no-brainer too that needed to be written. So like, talk about kind of why this needed to be kind of put in
Mhm.
ink.
Well, so it was actually listed as some of the critical and important outcomes that were identified by postpartum women. And so that's why we had to do a systematic review on it. And I absolutely agree. A lot of these systematic reviews are confirming the thoughts and even biases that we already had. Yes, of course, we know there's lots of data out there looking at the impact of physical activity on depression and depressive symptoms. That's well established in the general population. We don't have a lot of great evidence in the postpartum period until now. It improves depressive symptoms, it improves anxiety. Same thing when we talk about musculoskeletal pain. There's a lot of emerging evidence that suggests that being active and movement actually does
Yeah.
improve sensation of pain. And at the end of the day, those are the health outcomes that are important to people who are postpartum. And so we answer their questions and provide that evidence.
Yeah. No, and that's again, it on one hand, I look at this, I'm like, yeah, of course, of course, of course. But on
Mhm,
the other hand, I'm like, it makes it so much easier, I think, to talk to a provider, especially somebody that you're trying to convince.
mhm,
Convince of something that like the sky is blue and it's very obvious to you and me that the sky is blue.
mhm,
Having a systematic review and meta-analysis is a really nice way of saying, somebody else did all the work, so I can hand this off to you. So I
mhm,
appreciate the amount of work that takes to go into that. And I mean,
mhm.
hopefully that's how it's going to be used for those of us that like, there's not this one paper, there's a body of work that
Right.
says how we want that the sky is blue, right? So
Well, and I think the other piece to it is that, researchers and healthcare providers may be aware of this, but the general population isn't necessarily.
yeah.
There's this idea that if you have pain, you are causing more pain or
Yep.
harm if you continue to exercise. And certainly, if you have an injury, that might be the case. But
Right.
if you're experiencing pain, it may not necessarily be an injury.
Right. Right. And Lord knows after you have a baby, you feel a lot of things.
There's a lot going on for sure.
A lot of things.
Mhm,
All right, the next one running down, my personal favorite,
mhm.
it just needs to be put to rest always is postpartum exercise. There's pelvic floor disorders and diastasis recti. Um, are we ready to put diastasis recti to bed? Can we stop demonizing it? Like, please.
I'm not sure if I should answer that one. I think we're definitely taking steps towards demonstrating a little bit more, but I'm
Yeah.
not sure it's going to go away anytime soon. There's a lot more work that really does need to be done on this,
Yeah.
but it's very much a natural, normal, expected change that's going to happen.
Yeah.
And there's a lot of people who are starting to demonstrate very conclusively right across the world that it is not this terrible, harmful thing.
Yeah.
Yeah. So I think
No,
there's
I
more work that needs to be done for sure.
Yeah, no, I've definitely been seeing a shift away from that. It's the attention has now shifted over to coning and doming, so maybe that's gonna be your next paper you have to do. I'm like, why? People didn't even name it anything even, like 10 years ago. Why is it, why do we have to have a thing?
Mhm.
Um, but yeah, no, I always used to think, I still do, that diastasis recti is almost like a gateway drug to getting to physio because some people will come to
Yeah.
physio for that
Mhm.
and then mention their pelvic floor issue,
Mhm.
which to me is a much greater priority. I joke that I live in Virginia. I joke that, 99% of Northern Virginia thinks that they have a diastasis and they don't. So um, it's okay, gateway diagnosis.
Yeah.
I love, and maybe you can speak to this a little bit too. Our mutual friend Christina Prevett, she's been talking a little bit more about straight abdominal exercises, like rectus training in pregnancy and postpartum. And I've been thinking a lot about that too. And our kids are similar age. That period of time that we were pregnant and postpartum, where you're unfortunately we kind of put ourselves in an atrophy situation, in a deconditioned situation by saying, "Don't do this, don't do that."
Yeah.
Um, with the screening and the guidelines and these conversations moving forward, are there any other areas besides the abdominals that we might have been inadvertently deconditioning our pregnant and postpartum women all these years out of fear? I know that's a big question.
Yeah, that's a loaded question. Um,
As a
and it
researcher, you're allowed to comment as a researcher, not as a mom. We'll do the mom thing later.
yeah. So, it's tough, right? Because there are, when we talk about pregnancy and postpartum, we come from a standpoint where we are actually trying to demonstrate safety
Yeah.
and benefit, as opposed to virtually every other population where we are coming from a standpoint exercise, physical activity is good,
Mhm.
and let's identify where it may or may not be.
Right.
And so we have these very long standing um,
Beliefs?
Yep. Beliefs coming from expert opinion, theoretical risk. But as soon as we get that into into sort of like the social consciousness or fabric, it's really hard to be able to actually do the studies to counter that. So, for example, it's really difficult to get the ethics to be able to do high intensity
Yep.
interval training, to do heavy weightlifting, that sort of thing. And those restrictions are based on expert opinion.
Mhm.
And so I think, it's a really tough question to answer. Are we doing harm? We don't know
Right.
because we can't do the research, or it's a really tough thing to be able to do the research. Until we do that research, we simply don't know,
Yeah.
right?
Yeah.
And so it's really easy to come out and say we're doing harm. Um, but until you do that work to demonstrate it is potentially harmful,
Right.
um, I think it's just a difficult
Yeah.
conversation. But that's where research really comes in, and why we have to advocate for more women's health research in general, right
Yeah.
across the world. We have to test. We cannot guess, because even saying that those activities are safe, we're still guessing.
Right. Right. No, and that's where I do think, even for people that aren't working with elite athletes, that's where I find the research there really compelling.
Mhm.
And you've got a couple papers that came out, and then also a pregnant female ultra runner, um,
Mm.
where these athletes, this is their bread and butter. This is what they do. And if we can we extrapolate from what we're learning from them, which is like this, potentially is the average recreational athlete. Can we make some kind of basic understanding of like, hey, if this person can do this, generally this should be safe here. Like what have you learned kind of diving into more of the elite athletes in the ultra marathon world and that sort of thing?
So a lot of the work that I have been doing that's not out yet and that is in process right now is actually trying to understand the extremes of activity. So
Yeah.
it's at both ends.
Yep.
Certainly we have populations where we have this broad recommendation: you should not be physically active. They have an absolute, or in some cases, a relative contraindication, and so congenital heart disease and twin pregnancies. Type 1 diabetes, we have ongoing studies looking at the impact of physical activity in those populations to try
Hmm.
and provide an evidence base. Is it potentially harmful? And there are definitely studies out there demonstrating certain conditions where it is harmful. And in
Yeah.
those cases, physical activity shouldn't be recommended. Opposite end of the spectrum, we have these athletes, and there's lots of them that are going through their pregnancies in their postpartum, and
Yeah.
they're doing things that are well beyond outside of the scope of current
Right.
guidelines.
Right.
And that's great. That's their choice. They do it, partly because that's their identity. It
Yeah.
supports their mental health. We cannot understate the importance of supporting somebody's mental health. And
Yeah.
by saying, well, we have to ensure that, you're not causing harm, we may actually cause harm to somebody's mental health, which has a demonstrated
Right.
adverse impact to the baby
Yep.
by implementing theoretical concerns. So again, we have to test this information. And so we are looking at long duration exercise, so training over 60 minutes, which
Mhm.
there's a guideline out there which says do not ever go past 60 minutes in a population where they're training 2 to 3 hours at a
Yeah.
time. Um, looking at high intensity, heavy lifting, you name it, let's test those
Yeah.
limits. But those are really technical studies to do. You have to make sure that they're done well and
Yeah, I would
safely.
imagine.
And so there's a lot. It's actually a very difficult study to be able to run, but they're important ones, and I think that's what's going to start to change the guidelines.
Yeah. Do you feel like more athletes are open to participating because we've seen more athletes perform in pregnancy and postpartum? Do you feel like that there's kind of a shift to they want this information just as much as we do?
Yeah, I mean, they're desperate for the information.
Yeah,
So while they're doing it, what you don't often hear about, but what we hear in our interviews is that they experience quite a lot of stress and anxiety
I believe it.
while
Yeah.
they're doing it
Yep.
because they don't know if it's safe. Oftentimes, they will end up pulling back. We have some upcoming data which suggests that reducing activity levels during pregnancy actually doubles your risk of injury in the postpartum period. So
Mhm.
there's so much information that we need to know and understand, and
Yep.
certainly athletes are becoming quite aware of the importance of sharing this information and data. It's
Yep.
still really difficult to get it,
Yeah.
but for those that do, they're the ones that are really opening the conversation and changing the research. If we don't change the research,
Yeah.
and get better high quality research,
Yep.
the guidelines will never change.
Yeah, no, I think that's fair. I mean, it's funny, some people are like, well, why don't we have this information? And again, people forget the history. Like
Mhm.
even 5 to 10 years ago, you might have some women doing this, but they're doing it in very close circles. And the only people that they're, feeling comfortable, running or performing around are going to be friends that support them. And, if they put things out on social media, they're going to get, slaughtered. You sure you're going to hurt your baby like that? Nobody wants to subject
Yeah.
themselves to that. So the
Mhm.
fact that we're from a society perspective, yeah, all that trash is still here. But the
Mhm.
fact that we can do it and then we can actually help these people with, really getting into the nitty gritty on the research. Like
Mhm.
we couldn't have done this. This is like the earliest I feel like we could have even kind of had these conversations and asked these questions because we needed the subjects, quite honestly. So
No, exactly. And I mean, if you think back before the 2019 guidelines came out, like that was
yeah,
the first full synthesis of available literature
yep,
conclusively demonstrating the safety of exercise. Before that, there were constant questions about,
hmm
if you're training at a moderate to vigorous intensity level, is it actually safe? Is it potentially
hmm
going to restrict the growth of the baby? And we very conclusively demonstrated it does not cause miscarriage. It does
yeah,
not cause an early delivery, and it doesn't cause a small baby within the scope of the guidelines. Now we need to extend that research
yep,
to those more extremes. And so as we start to see that more and more, people are starting to share their data, and that data sharing, that information sharing is so, so critical.
yeah. No, absolutely, absolutely. All right, the last question I wanted to ask you about. You got to go to a very cool place in the last year. You got to go hang out in Nepal.
Oh
What did
yeah.
what did you do in Nepal, and what was that like?
Oh my goodness. It was just the most incredible experience. So, my husband is a high altitude researcher. So, he looks at the effects of hypoxia, so low levels of
Oh,
oxygen
wow.
on the body's physiology. So, that can be, trekking to high altitude. It can also be different medical conditions like chronic obstructive pulmonary disease, that sort of thing. And he looks at all of them. Um, so there's actually been 3 expeditions where, Craig and our trainees have gone to, Nepal to do some exercise testing, with, women who are native to the
Yeah.
region, who are living, at high altitude. Because current guidelines, and this is right around the world, basically say that if you are above either 1,800 or 2,500 meters, that you shouldn't exercise. Well, if you're somebody who is born and raised at high
Right.
altitude,
Talk
those
about
guidelines
bias.
are inappropriate. So
Yeah.
back in, I think it was 2015 or 2016, one of Craig's colleagues was doing a high altitude expedition going up to base camp, and one of the guides showed up and she was 6 months pregnant, and he was like, oh my gosh, what am I supposed to do? So I
Right.
got this text in the middle of the night, and I'm like, accelerometer on her, measure oxygen saturation,
Mhm.
and like, have her do fetal counts,
Mhm.
to make sure baby's moving and that sort of thing. They went and trekked all the way up to Everest Base Camp, came back down, delivered a very healthy baby. Like, this is part of her
Right.
daily life. And so, anyways, that sort of started or sparked this question about, is this guidance about high altitude exercise? Is it appropriate? Is it not? And so, we've just wrapped up that particular series of studies. It was all done in consultation with people who actually live and work in the region. Those are some of their questions that we're incorporating,
Mhm.
for sure. And so, yeah, anyways, it was great because my husband and I were there, and because we were gone for a month, we dragged our two kids out of well, for a month. It was like grade 4 and 6. It's okay, I guess. And so they got to join us, mostly because I'm not leaving them for a month, and
Right.
nobody would come for a month either.
Right.
And so it was just a really phenomenal experience to be able to get to know some really lovely people. They were so excited. We had a clinical sonographer with us, and so they were able to see their baby, make sure that it was okay. We were working with
Oh, wow.
clinicians there. We did some health testing that they would not have had otherwise, and
Mhm.
um, it was just lovely. So, anyways,
That's
that day
really
was
neat.
spending out looking at exercise in high altitude natives, and it is exactly what you would expect.
Right. Oh my gosh. No, I am that's a part of the world I'm fascinated by, and Everest and base camp and that whole
Oh,
thing. Is there I feel like because I had a colleague that had gone there a number of years ago
hmm.
for some pelvic health sorts of things. Is there a difference in incidence of birth injuries that you recall off the top of your head or no?
Off the top of my head, I don't know, but we did definitely ask about pelvic floor dysfunction.
Yeah.
Yeah, when we were talking with the ladies, and it was great because, I was able to WhatsApp Emma Brockwell and be like, Emma, I need some resources for these individuals who, don't have any access to a pelvic floor
Yeah.
specialist. Where can I direct them? Like, is
Yeah.
there a video of you talking? And so she was able to support
That's
that,
so
and
cool.
so I was able to link them, and a lot of them had never heard of it. Pelvic floor dysfunction and urinary incontinence, and
Yeah.
they were so excited, maybe relieved that
Yeah.
there was actually something that they could do about the leaking that they were experiencing. So that
Right.
was that was pretty rewarding too.
That's I think when you have these international conversations and I've been lucky enough to go to World Congress a couple of times and talk
Mhm,
to other pelvic providers. I think, first of all, a lot of us don't realize that there's some countries just trying to get recognition for healthcare for women. And
mhm,
then there's countries like that where, just they've never even heard of us or what we do or that this stuff, we
mhm.
can do anything about it. And
Yeah.
I think that's it kind of goes back to that elite kind of average person conversation is what can we take about all this from this amazing research that we're pulling together
Mhm,
and simplify it and distill it down to something very basic to give to someone
mhm,
that is in a different environment than us, but still could benefit from some basic
mhm,
information. I think at the end of the day, like we've got to figure out ways to take all this amazing research and yes, be able to use it for a high level athlete, but then also extrapolate it for, someone who lives at such a high altitude and, doesn't want to
mhm.
leak when they're, carrying stuff around their village. That's so cool.
Oh yeah, it was
What an amazing
amazing.
experience.
Yeah. Yeah, and it's sparked a collaboration that's ongoing.
Mhm.
So we're going to be supporting some clinician researchers there,
That's super cool.
which is great to help them to answer questions that are really important to their community. So I hope I can go back soon.
Okay, well, if you need a Sherpa, I will volunteer for that. I will carry anything. All right, I think we hit a lot of topics. I want to be respectful of your time because we were on the clock today. I can't thank you enough. One for coming on and continually talking to us and sharing all this information, but making it approachable and doing the work that we need to have in print. And I can't possibly imagine how much work it is to pull this stuff together. But just know that it's so cool to have been in this field so long and see so much change in recent memory. And it's really cool to see names up there where I'm like, yeah, I know they do good work, and the stuff that's going to come out is going to be amazing, and resources, not just for you and your community, but really keeping everybody on this earth in mind. And that's just a really cool thing. So thank you for doing that. So,
well, thank you.
all right. So this time next year,
Yeah.
we'll make it a date.
There's some new big projects coming, so we'll have more to talk about.
We expect it. We expect it. If you want to find more about Margie's work and her team, you can find her on Instagram, Exercise and Pregnancy. Thanks again, and we'll figure out when to put this up so that we're in line with everybody's release dates. All right. Thanks so much.
Bye.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.